We're going to demonstrate how to do a test like dynamic visual acuity test. This is one of the good tests to find out how the vestibular system helps to maintain the target while focusing with regards to the head movement. If there's any impairment, we can ask the patient to train vestibular adaptation exercises. In order to do the test, we test in two different variations. One is static acuity test. Second one is dynamic acuity test. Before you start the test, this is the eye charts recommended. Keep the patients away from whatever the chart is recommending. Which chart recommends to 12 feet away from the chart. First to test the static and then test the dynamic. In order to test the static visual acuity test, ask the patient to read the first letter first. Can you read them now?
E, F, T, L, P, E, F, D, L, F, P.
He is very good about this. But for example, assume this patient could not read L, that means we won't ask the patient to read the full line right now.
L, E, F, O, D, P, C, T.
So you could read it. So his static acuity is number 9. So this is the baseline test to find out. So we're going to compare this 9 with a dynamic visual acuity test. When a dynamic visual acuity test is done, he is going to read while head is moving. That means he needs his V/O reflex to be good so that he can read better. Okay. In order to do this, the test is recommended by using a metronome. The head should be moved in a 2 hertz. That means like two rounds in 1 second. So we used to set up a metronome in 240. So when the beat is happening, he's going to make a head is moving side to side in 1 second, 2 rounds. Okay. So what we can do, the metronome is on right now. I'm going to hold the head and then I'm going to ask the patient to read while I'm moving with the head metronome sound. You're going to start reading from the number 1.
E, F, P, T, O, Z, L, E, E, D, P, E, C, F, B, E, D, F, C, Z, P, F, E, L, O, P, C, D, D, E, F, P, O, T, E, C, L, E, F, O, D, C, F, C, T. That's
Good. So technically what he did was he could read up to number 9. So he does not have any difficulty with the dynamic visual acuity. For a patient with a peripheral vestibular disorder, there's a possibility when the head is shaking, they could not read the line exactly as the static. For an example, in a static visual test, if the patient could read number 9, well, the head is moving. If the patient is able to read up to 9, that means they are normal. Or in a younger adults, it can be possible when the head is moving, still 1 line, still considered to be normal. For older adults, if it is 2 lines, it's considered to be normal. So if older people with the vestibular compromise, if the static is 9, if the dynamic is going to be 6, that shows that it's abnormal dynamic visual acuity test. These patients could be benefited better with the gaze stabilization exercises. Thank you.